welcome, welcome, welcome. We're celebrating Women's Health Week. Today we're celebrating women, we're celebrating families, and we're celebrating everybody. But this is our week. Let's get a hand clap for that. Welcome. Welcome to our Women's Health Moment or Movement. And throughout our presentations today, you will understand what we mean. Is this just a one-time thing, or is this a movement that we are going to carry on with other movements throughout our country today? This is the Louisiana Center for Health Equity's 7th year for having this Women's Health Retreat Day. My name is Diane Hargrove Jupiter, and I serve as the Vice Chair of the Board of Directors, as well as the chairperson for this lovely event.
Thankful for this day. I noticed that it said Women's Health Day and Retreat. And as women, so often we have a need to retreat because we work, we make things happen, we create solutions, we make ways out of no way often. We try to be the neck to turn men that we may have leadership over and sometimes influence with, to have a collaborative approach to solve problems in Louisiana. So I'm very thankful for your commitment. I'm very thankful to serve under a governor who's committed to women and has worked diligently for women's health issues throughout his administration and throughout our state. And so First Lady Donna Edwards was invited to speak here today. I adore her, and I'm thankful for her humility and the trust that she's given not only the administration, but how she undergirds her spouse in the fight for us, for Louisiana women, and how we have so much opportunity to create great change, and it takes all of us, essentially. And so she sent a letter, since, as you can imagine, the schedule is always demanding, but I really appreciate the words that she shared with us today, and I'd like to share them with you. From the desk of First Lady Donna Hutto Edwards, State of Louisiana, May 16, 2018. Dear friends, although I cannot be with you today, I stand shoulder to shoulder with all of you as you shine light on the importance of women, our great state, making their health and living a healthy lifestyle a top priority. In our state, women make up half of the population, 55% of registered voters, and lead the majority of single-parent households. This issue is not only important to me as the First Lady of Louisiana, but also to our governor, which is why he has proclaimed today as Women's Health Day in Louisiana. Yeah, that's awesome. As he has stated, women's health remains a priority for our families, communities, and government, and our commitment to keep women healthy remains stronger than ever. In addition, John Bell adopted Medicaid expansion upon taking office. Thank you, Ms. Alma, and the leadership, Senator Barrow, and all of the leaders that helped that become a reality, which has enabled more than 475,000 women and men, the majority of whom are working, to have health coverage, for some for the first time, and more importantly, improve health overall. In fact, under expansion, more than 41,000 women have been screened for breast cancer, and nearly 400 have been diagnosed and are receiving treatment. Expansion is saving lives. Together, we fight for raising the minimum wage and closing the wage gap so that women earn equal pay for equal work. A March 2018 study by the Institute of Women's Policy and Research ranked Louisiana 48th in the nation for female employment and earnings, but according to the 2018 America's Health Rankings report, the percentage of uninsured middle-aged women has decreased by 34% since 2016. That's notable. We know that when women succeed, children succeed, and families succeed, and that is so true. Women are caretakers, and often we can get so busy taking care of our families, friends, and work that we forget to take care of ourselves. As someone once said, the greatest wealth is health. The better we take care of ourselves, the better we can take care of others. Keep up the good work, and let's continue to encourage one another and spread the word. God bless. Donna H. Edwards, First Lady. Thank you.
It is so good to see so many of you out there today celebrating Women's Health Week and month and year. Because you know what? It never stops, does it? It never ends. I would just want to say that I really appreciate the First Lady, and that was a wonderful letter that Dr. Proctor just read. I mean, that was just so enlightening and so encouraging. I mean, just give her another hand of applause. Because I was like, I don't know if I need to add anything else to that. I mean, that covered everything. But certainly I want to welcome each of you. And as always, many of us wear many or multiple hats, as I am. So I'm on my way now to the Health and Welfare Committee, where I'm the vice chair of that committee. And so I'm going to have to leave as soon as I finish. But I do want to thank, because I see so many of my friends in the audience, for your advocacy and your work and your labor and your commitment to help make change, because certainly we cannot do this work on our own. It's your advocacy, it's your work, it's your commitment, it's your undying love that continues to fuel us to keep us doing what we need to do. And I just want to say thank you to each of you. And certainly I'm honored to serve with a governor that is committed to the people of this state, committed to the women of this state, and have made this a priority. Is so much so that he's actually moved the division back under his office to make sure that there's no more gaps in delivery of services, and also the funding as best possible when we get some more money here, guys, to ensure that these programs are properly funded. You just have to give him a hand of applause, because you know that there has been some gaps. And it's so sad to say that here we are some 100-some years later, and we are still fighting for equal pay, for equal work. I don't even want to go into that whole scenario, because it's really disheartening. But this is what I do believe, ladies. I do believe under this governor, and with the push of the advocacy of groups like you, we're going to turn this around before the next 4 years is over with.
I'm honored to have an opportunity to share this exciting and extremely important topic related to biomedical research. On behalf of the Delta Research and Education Foundation and the National Institutes of Health All of Us Research Program, as a local volunteer coordinator, thank you for inviting me to speak about this great program. Today would not be possible without the vision and hard work of the Louisiana Center for Health Equity and the Louisiana Legislative Women's Caucus Foundation. So thank you all for organizing this worthwhile event. We are really, really, really blessed to be here. So let's give them a round of applause for all they've done. It is so encouraging to see so many of you here today to champion for women's health and wellness in our beloved Louisiana State Capitol. It is a perfect place to celebrate women, because it is here where the laws are passed to ensure that women of Louisiana have equal and affordable access to health care. My sincere gratitude to our Governor, John Bell Edwards, Women's Policy Office, and to the Louisiana State Senators for your continued commitment to women's health concerns. The Louisiana State Capitol is a hub for citizens rushing through the halls to address local matters. And on today's agenda is the health of women in Louisiana. We as women, we wear many hats. We are wives, we are mothers, we're grandmothers, we're daughters, we're sisters, we're teachers, we're preachers, we're engineers, we're nurses, we're lawyers, we're doctors, we're waitresses, we're senators, and we're mayors. Look, we can wear all of those hats. Don't we wear them all, ladies? So oftentimes, and some of the other, our first lady talked, everybody was in my speech, so you're gonna hear some repeats. But oftentimes, we wear all of these hats, sometimes all at one time. And that can be time-consuming, a lot of weight to bear for women. So sometimes we end up neglecting ourselves. We're trying to take care of everyone else, and we neglect our own health. So with that being said, we really should make some changes. So the Center for Disease Control reports that heart disease is the leading cause of death for women in the U.S. Although heart disease can sometimes be thought of as a quote-unquote man's disease, the same number of women and men die every year from heart disease in the United States. Heart disease is the leading cause of death in African American and Caucasian women in the United States. It is the second leading cause of death, tied with cancer for Hispanic women, and for American Indians and Asians, it is second only to cancer. Also, 2/3 of women who die suddenly from coronary heart disease have no previous symptoms. So you can be walking around today with no symptoms. I just recently, this week, maybe yesterday or the day before, I had a patient whose mom came in with her 6-year-old daughter. She's about maybe in her late 30s, early 40s, just had open heart surgery. She doesn't have any risk factors as far as you can see on the outside, but she was having shortness of breath, and just all of a sudden, she went to her doctor, they ordered a exercise cardiac test, and she has severe blockages, had to have, bypass surgery. So we never know, you don't know. So this state has one of the highest incidences of heart disease death rates in women 35 years or older, Louisiana. So we must make a shift. We have to make a change and look at our health as a priority. We have to consider ourselves important enough. Why should we consider this? Because we cannot effectively help our loved ones if we are not healthy ourselves. So I would say this, the airline industry got it right. When they tell you, when you're on a plane, the flight attendant says, put the oxygen mask on yourself first before you can help your neighbor. And that's what we should do. We have to put our health care first. We really do. And if we're not whole, we can't help our loved ones. We really can't. So we have to be conscious of that and start making intentional efforts to do that. Today, I want to invite you to take a ride with me on a health journey, a journey to wellness. The mode of transportation today won't be by plane, it'll be by train. Let's get on board the National Institutes of Health, all of us research trained. I'm going to show this short video, and then I'll come back and we'll discuss a little
Meet
more.
Ray. Ray lives on a farm. He loves playing kickball with his grandkids, but lately he's gotten a little slower and been visiting the doctor a lot more often. This is Kim. Kim lives in the city. She loves to exercise, cook healthy meals, and can't remember the last time she called in sick. They're both people, but not all people are the same. And yet, when we visit the doctor, our treatments don't look that different. Why is that? Because we just don't have enough information to do it better, until now. Enter all of us. The research program based on precision medicine. Precision medicine is a revolutionary new approach to treating and preventing disease that's personalized instead of one size fits all. By gathering health data from 1 million people like Ray and Kim and Trevor and Samir, our country's best researchers will be able to develop treatments that are as unique and complex as we are. With this new information, doctors will have a better understanding of disease so they can innovate the next great breakthroughs in medicine. Once enough people join, suddenly everything changes. Information becomes clear, patterns emerge, and simple data transforms into life-saving knowledge. This means that Ray and Kim's children and their children's children can live longer, healthier lives. By becoming one of the first 1 million people to volunteer, you can help reshape the entire future of healthcare for generations to come. If we can figure out how to fly, put a man on the moon, and connect the entire world, surely we should be able to improve the future of healthcare. Not just for Ray and Kim or even you, but for all of us. Sign up at joinallofus.org. The future of health begins with you.
So the future of health begins with you. It begins with us. It begins with me. Can we say the future of health begins with me? Let's health begins with. Let me hear it again. The future of health begins with me. And you can be one of the first million to become a part of the All of Us research program. So today I'll briefly discuss the key objectives of this national campaign and the plan and implementation of it. Secondly, I'll let you know how you can get on board and join us. Lastly, if time allows, I'll answer any questions you may have. First of all, the All of Us research program has been established by the National Institutes of Health, or NIH. The NIH has realized that some populations, genders, and ethnicities have traditionally not been involved in biomedical research. Therefore, women specifically have not been participants in clinical trials in great numbers. The All of Us research program's ultimate goal is to enroll people of diverse groups who have not been well represented in clinical trials. Enrolling into the NIH's National Registry creates a database that significantly increases women as potential participants in clinical trials. The NIH has selected 4 initial community partners to support this effort. The Delta Research and Education Foundation, also known as DREFT, in collaboration with Delta Sigma Theta Sorority Incorporated, is one of the 4 partners selected to engage, educate, and encourage our communities to join the All of Us research program. The All of Us train is designated to stop in 12 cities in the United States, with New Orleans being one of the cities and its surrounding cities as well. The goal is to enroll 1 million people into the program with the potential to participate in clinical trials. Why is this so important? So, as a physician by trade, we as physicians are trained to treat medical conditions based on clinical practice guidelines. These guidelines are developed based on evidence-based medicine and clinical trials. However, if specific groups are not represented in these trials, then the treatment plans may not necessarily treat certain groups effectively. Hence, leads us to the discussion of precision medicine. Precision medicine is simply stated medical treatment precisely for you. For example, we as women are genetically different from men. Therefore, the management of heart disease for men, maybe it should be different than the treatment for women. However, if women were not signed up for the database and did not participate in clinical trials, there was no way for the medical community to develop specific treatment guidelines for women with heart disease. The All of Us research program will allow for more specific treatment for multiple disease processes now and in the future. The DREFT initiative is appropriately entitled Research Matters, Creating Possibilities to Achieve Health and Wellness for All of Us. This is about all of us, all of us. We all have to get on board. It is not just about now, but it's about generations to come. This research will improve health for not just us today, but for the next generation. When we think about leaving an inheritance for our children and our children's children, we often think about monetary or physical possessions, but what about leaving an inheritance of good health? We can break generational curses, hypertension, heart disease, cancer. Let me give a quick testimony. I'm gonna make it quick. I was diagnosed with hypertension, was taking 2 medications for my hypertension. I decided to break the generational curse. I continued to take my medication. I started making the green smoothies, drinking green smoothies with organic vegetables and fruit. Within a few months, I was off all of my medication. You know, that can help other people. You know, I signed up already, but, you know, when they get this information, they can develop treatment plans where we can just do lifestyle changes and not be on all this medication that causes other problems as well. I'm a doctor, I prescribe medicine all day, every day, but I would rather my patients do something natural as opposed to taking medication. So this is what this research program is about. So you've heard all about it. How can you join us? How can you get on board? You can learn more by visiting the DREF Research Matter website. You can sign up online. You can encourage your family and friends, colleagues to sign up. You can educate your community about the program. You can contact us if you want us to come to your community, to your social organization, your professional organizations, your church, to inform them about the initiative. We'll be glad to do it. So as I close, I want to thank you all for allowing me to share this journey to wellness with you aboard the All of Us research train. Please join us to get on board because the future of health belongs to you. And this is a flyer. You should have a flyer. Thank you so much for having me.
The League of Women Voters has been around since 1920. Actually, the League of Women Voters got women the right to vote. We've been in Louisiana since the 1940s. We are a nonpartisan, political grassroots organization. We encourage informed and active participation in government. We work to increase understanding of public policy, influence public policy through education and advocacy, and we are a statewide membership. We do have strategic local units. We have 5 units around the state, and they're strategically placed. And so I invite you to go to our website and read those. But I'm going to talk today about the policy position on health care. We have a number of positions. Those positions come to us after considerable study and consensus from the National League and through the State League. So what we do well, and we do it through consensus. So I invite you to go to our website and see that. But I'm going to talk to you about the health care, because I am the health care state person for the state. I'm the program person. And also, like Diane said, we sit on the Department of Insurance, Louisiana Healthcare Commission. I'm a commissioner and have been on that for quite a while. Healthcare, the U.S. League adopted it in 1993, and our position on healthcare. So it's not something new for us, but we did that after considerable 2 years of study. What our basic position is, it's a basic level of health care, both physical and behavioral, for all, at affordable and available to all citizens, nationally financed, general taxes, employer-based. We strictly oppose a private, market-driven system. It's got to be effective with cost controls. And it's not based on the ability of a patient to pay for services. And it goes into more steps, but you can read of that. I'm going to set the stage for you with some basic terms. I was given the assignment of health care access and services and Medicaid, but there's so much more than that, okay? So let's understand what we're talking about a little bit. When we start talking about terms and public policy. What is public policy? These are very simple terms now. I simplified them for me. It's a course of action that is adopted and pursued by government. They include principles, statements, and positions. Basically, it's the philosophy is where that all comes from. It's the basis. Excuse me. Laws, legislation, rules for goal accomplishment, they may include resources, funds, budgets required for the public policy goals. Legislation. What is legislation? The action of making laws. The purposes could be to regulate, authorize, outlaw, sanction, grant, restrict, and on and on and on. Healthcare access. What is healthcare access? I mean, we throw that around, but what is it? Well, it's the ability to obtain needed healthcare services. Again, medical and behavioral. There's components to healthcare, and the components are coverage, services, timeliness, workforce, geographic locations. I want to talk about coverage for a little bit, because from the women's standpoint, coverage plays a very, very, very important role. However, there are other factors that play a role in that, and that could be the cost of out-of-pocket expenses. It could be provider availability in some of our rural areas. It could be logistics, transportation, and workplace flexibility. Women also oftentimes are charged with the health care responsibilities of children. So if the transportation is not there or they have to work, those all are factors that are very, very important. So since we have the terms understood, let's go to access to health care a little bit. And I guess the ladies that I have in the audience, if they could pass those, okay, they passed it out. Thank you very much. Access to health care. Access to health care, funding equals access. Funding equals access. And you'll hear that a lot in this legislature, okay? But access to health care, it could be self-funded. You might have to pay for it out of your own pocket. It could be through your employer. It could be through co-ops, faith-based groups, organizations, Louisiana public communities. It could be government-based. It could be federal, state, parish, or local, standalone, or blended, and other forms. Why am I telling you all of this? Why do you all care about all of this stuff? Well, you need to care about it because when you go forward, you need to understand how this is all coming together. So this next slide, you really can't see too well. Oh, they're not advancing the slides.
Yeah, it's there.
Okay. Were you advancing the slides, though?
Yeah, he was.
Oh, good. I'm thinking, oh, I'm reading this and y'all can't see it. Anyway, I have a little chart here that I had used for when I do a 101 healthcare, and it's about a 2-hour group. I did it for New Orleans, actually, way back. In 2012, we did a 2-hour class on understanding healthcare and where it came from, the origins. So this little chart is simplified, but you will see on the chart, if you look at it, it all starts with the individuals, then businesses, public or private, and it goes through, and you see all the middle people in between, and this is simplified. Ends out over here to obtaining your care. So when we start talking about, well, let's simplify this whatever we're going to call it, but this healthcare system we have in the United States, because it's not like this all over. Remember, they said that my experience has been, I ran the programs for Europe, for the Europeans and for the Canadians. So I had the opportunity of paying for costs for veterans who lived in those areas. So I understand the differences when it is a system that is nationally funded. You may have more opportunities. So that, I'm going to let that take that with you. So when people start saying, oh, well, just do this and do that, well, you know, you got a lot of folks involved in that. You got a lot of profit folks and nonprofit folks. Access to health care. I'm going to go real quick through this. I didn't talk about Medicare. I got 5 minutes left. Okay, thank you. I'm going quick. Access to health care. Medicaid. What is Medicaid? The term sometimes is being used as not very friendly, especially when you're up here in the legislature. It simply means medical aid to states. That's it, folks. That's all it means, but it's been termed over the years. It came from the Social Security Act of 1965 with the amendments. The federal government pays the states in proportion. The state administers and decides who's going to get it. Well, when we get to the bottom, you will see here with the Medicaid expansion, how it was able to happen in Louisiana. If you look at the Affordable Care Act, which I am not going to go through, that's the other major component of providing care in Louisiana. That was the only way we were able to get Medicaid expansion, through the Affordable Care Act. And our governor signed off on that for us. And the advocates have been fighting for 4 years prior to that to try and get it. So it's been a long, hard fight. So we really appreciate the governor putting this into place. Let's move on because we are terms. Now you'll hear in this legislative session, Medicaid, we got to cut Medicaid, it's costing us too much. There's going to be traditional Medicaid and there's going to be legacy Medicaid. And so now I'm not going to go through all of those, but there's some legacy programs in there. And the expanded programs, many of the people who were in the legacy program moved into the expanded program. That's why it's so large. Access to services and funding. Where does this Medicaid come from? Well, Medicaid pays directly to providers. I'm going to say that. Medicaid pays providers. Recipients don't touch the money, okay? So when they say, oh, these folks are taking this or these folks are taking that, no. It goes to the providers. What does it pay for the providers? In Louisiana, 70% of our births are paid through Medicaid, okay? Nursing homes, 80% of the nursing home beds are paid through Medicaid. Children, CHIP program, 95% it pays for. People with disabilities, elderly, adults, when we expanded our Medicaid expansion, that was for very low income. Public-private partnerships, all of these private partnerships, remember when our charity system, our last administration, decided they were going to change that. They did public partnerships. Well, all of those hospitals are paid for Medicaid dollars. That's why they're screaming right now if we don't have Medicaid dollars. Physician training, they pay to train physicians. They also give grants and they also give out computers. So Medicaid is not a bad word. It's medical aid, okay? We have to keep reminding some of our. Marketplace insurance, I'm not going to go through that. Marketplace insurance directly pays the insurance companies. The insurance companies are being paid for the subsidies that when folks in Louisiana get subsidized to make their insurance affordable. Then prior to this last administration, however, the federal government, I see your fingers, your federal government would pay the insurance companies directly. Why protect it? That's what I'm supposed to talk about. Why protect it? Well, Louisiana's snapshot, poverty rate, 20% poor, health ranked 49th nationally. However, that's better because we were 50th before we got Medicaid expansion. Believe it. Uninsured rates, they talked about that a little bit, but our uninsured rate is anticipated to be less than 9% this year. In 2013, it was 21% before we had Medicaid expansion, an ACA that went in. Medicaid expansion, they have talked about this a little bit, so I'm not going to mention it in terms of Louisiana. There's 573,351 lives that are covered. That includes both the ACA and Medicaid expansion. So when we look at it, we can see what a great deal this is. What's at stake? You can read that. Health safety net erodes, lives are threatened further, poor, elderly, disabled, and children. Hospitals are closing, nursing homes are closing. Uninsured rate goes up. And what does it mean to the businesses? Businesses are going to be affected. The healthcare system increasingly uncertain and financially unstable. Jobs are lost. People are moving out of state. Employers leave the state. Destabilization. The state sends money to other states. That's what's going to happen. Now, the next slide is our legislation. And I'm just going to throw this up against the wall real quickly because we've been really, since February, the first special session, and now we're getting to the regular session, and now we're going to the third session. You've got to pay attention what's going on with these bills. Senator Broom bill of 558, that's an interesting bill. It did pass, and it was to provide incarcerated women with sanitary pads. Isn't that something? toilet paper, too, they got. House Bill 334 by Senator Bacala, that was to expand long-term Medicare to keep people in homes. He pulled the bill. He didn't have enough support. The other bills that we're watching real closely, and I just talked to Senator Barrow about that, was HB 88, and that's being, I know she's cutting me off, that's BH8. You can read all of these bills, but these bills will be coming up in the special session, and many of the senators are pushing for workload requirements for Medicaid patients. You must pay attention. Okay, turn your sheet over. You're involved, you're informed, this is what you need to do. There's some information on how you contact. And one thing I want to talk about is about amplifying your voices. You can't do it alone. A League of Women Voters has to partner with everybody else. Everybody else has to partner with everybody else. So we have to amplify our voices. And I want to just let you know that it's important because one organization, one church, one person can't do it. But us together, we can do it, and we will do it. Thank you so much. I appreciate it. There was a song coming today called Glory. I know y'all know this song, I Will Survive by Gloria Gaynor. I know. It's my, all right, she says she will survive. No, I say we will thrive and we will rise.
I am Brittany Hunt, and I am the Justice Systems Coordinator at the Louisiana Foundation Against Sexual Assault. And I'm feeling very fancy in front of this podium. Gotta get some photo ops for my Tinder profile. So I am so excited to be here today. If you don't know the Louisiana Foundation Against Sexual Assault, we are the state coalition of sexual assault agencies. So we accredit and then work doing training and technical assistance with 11 of the rape crisis centers in the state. So we are kind of their voice statewide to talk about how we can help sexual assault survivors and ultimately end the epidemic of sexual assault. So when we talk about sexual assaults, Louisiana has some amazing laws around sexual assaults. We actually have some of the best laws in the country, I think, around sexual assault, around cyber crimes related to sexual assault, so video voyeurism, non-consensual image sharing. So this is something that is illegal. And everybody knows that sexual assault is illegal. Everybody knows that. So why is it still happening? 1 in 5 women will be sexually assaulted or will be raped or attempted rape in their lifetime. And even more than that, 44% of women will experience some other form of contact sexual violence. So this is something, if we have good laws around this, why is it still happening? So I'm here today to talk about how we need to shift our focus from seeing sexual assault solely as a criminal justice issue into seeing sexual assault as a public health crisis and a community issue. Because we've, for 30, 40 years in this movement, we've been working to improve police response, to improve prosecution rates. And that's something we still absolutely need to be focusing on. But we've realized that's really not enough. This is something that things haven't gotten better. I think it's out of the shadows now. People are talking about it more, but rates have not gone down. So how do we take our movement and kind of shift the focus into something that's actually going to make a difference? So how is sexual assault a public health issue? Let's talk about some of the health impacts that happen after a sexual assault. We're going to talk about from an individual perspective for a victim as well as society-wide. So victims are much more likely to experience a load of mental health problems. So that's depression, anxiety, PTSD, eating disorders, all suicide, all kind of mental health issues. They're also much more likely to begin to use alcohol and drugs. So that's something that's also, people talk about the opioid epidemic that's going on right now and kind of drugs in our society. And we need to be looking at the root causes and why people are turning to drugs and alcohol. People who are sexually assaulted, women who are sexually assaulted, may experience STIs or unwanted pregnancy. And that could be as the result of an assault or down the line. There are really long-term impacts on women's reproductive and sexual health after an assault. And that's because, a lot of women after being sexually assaulted might have trouble negotiating with their partner for birth control, for condom use, so may, even after an assault, be more likely to experience these negative health impacts. And there is mounting evidence that sexual assault has an effect on other physical health issues, so gastrointestinal issues, heart disease, and that's something when your body goes through that trauma and goes through that stress, it's not just in your head, it's gonna present itself in your whole body. So we know that sexual assault is a health issue. And beyond that, after a woman's sexually assaulted, she's much more likely to have negative educational outcomes, not do as well in school, perhaps drop out of school. A lot of women will have to leave their jobs after a sexual assault. And actually, sexual assault affects a woman's lifetime earnings. So if you're sexually assaulted, you're gonna, over the course of your life, make less money than someone who's not, which is super crazy. So we know that, this is something that's very serious and is hurting a lot of people. It's really devastating a lot of women's lives. And that's something that I think we all in this room really take seriously. We know that, sexual assault isn't wrong because it's a crime. It's a crime because it's wrong. And I think that's so important for us to recognize. Unfortunately, a lot of the people downstairs who aren't like us have trouble, I guess, just seeing this issue as something that's morally right and something that, they just have empathy for women and this is the right thing to do. So we have to also talk about the economic impact of sexual assault, because I think in Louisiana, if you're talking about saving money, people are listening. So according to the National Alliance to End Sexual Violence, so they're like, we're the coalition for Louisiana, they're the coalition of coalitions. Sexual assault costs $127 billion per year in the United States. And that's each rape costs approximately $151,423. So those are the criminal justice system costs, those are the health care costs, lost wages, and kind of all of that. So it's something that, think of what we could be doing with that money to educate children, to make people's lives better, if we just didn't have this epidemic. So what I'm saying basically is, sexual assault, it's not about just rounding up the bad guys and throwing them in jail, even though I think we should do that as well. It really is recognizing that, it's not the problem of a few bad apples. We need to look at what's making those apples so bad. This is something, it took hundreds and hundreds of years of oppression and of power struggles for us to get to this point. And it might take us hundreds of more years for us to dismantle all of those oppressive systems that allow sexual assault to thrive. So the reason we have sexual assaults, it's not because of these criminal monsters, it's because we have oppression. And this is an issue that's so intersectional. It's not a coincidence that women are the ones who are disproportionately sexually assaulted. It's not a coincidence that women of color are at higher risk. 50% of Native American women will be sexually assaulted in their lifetime. That's not a coincidence. It's not a coincidence that trans women are more likely to be assaulted. 80% of women with developmental disabilities will be sexually assaulted in their lifetime. And this isn't just, a coincidence. This isn't about sex and that those are the sexiest women, so they're the ones who are sexually assaulted. No. This is about power. And this is about people in power using that power to keep another group down. And those groups are very intersectional, all sorts. But the only way to end sexual assault is to dismantle those systems, which is hard. I'm not saying we're all gonna walk downstairs right now and be like, all right, we're gonna end depression, bye, because that's not gonna happen. But there are steps that we can take in this room after this to make sure that we are doing the most that we can to raise people up, to give people power, so they are less likely to be victimized, and so we can shake up this system and change it. So that means, laws that aren't necessarily just focused on sexual assault, not the obvious stuff, but looking at the wage gap and fair pay, looking at giving people a living wage. If people have those resources, they're less likely to, be assaulted, and we can kind of shake up those systems. We have to look at laws around reproductive justice and make sure abortion and birth control and sex ed are accessible and that's there, because that's extremely important. We need to make sure people have equitable health care outcomes through improving Medicaid, universal health care, immigration. We know undocumented women, if you're a sexual predator, you can prey on an undocumented person and they're not going to the police. And we need to make sure we're solving that. So yeah, this is about power, and anything that we can do to give women and to give other marginalized people more power is what we're gonna do to really end this problem. So there are organizations locally. You can certainly reach out to the Louisiana Foundation Against Sexual Assault, as well as any of the rape crisis centers in your area to get more information about what you can do. But I think being here today and starting to think about how sexual assault doesn't just affect the 1 in 5 women who are victimized, it affects our whole society. And it's going to take our whole society changing for us to end this problem. So that's all I have. Thank you.
Well, that's a pretty hard act to follow, and I congratulate you. For those of you who might not recall my introduction, I'm privileged to be here with you today, and as a mother, as a wife, as a grandmother, as a sister, and as a citizen of this great state, I would be remiss in not beginning my remarks by acknowledging the extraordinary leadership of Governor John Bell Edwards and his wonderful wife, Donna. I am privileged to be here and to have been asked in my current capacity to address this remarkable group of Louisiana's most cherished citizens, its women. I want you to know that I serve as the Chief Operating Officer, and it gives me incredible responsibility over our advocacy agenda, but it also affords me the privilege of working in our Community Impact Department for United Way. It's my sincere hope that each and every one of you here today are aware of what United Way is doing within your respective communities. I happen to work for the United Way of Southeast Louisiana, where we represent 7 parishes, but we are one of 12 United Ways that form an umbrella system serving the health and human service needs of the communities in which we are located. I'm especially proud to tell you that United Way fights for the health, the education, the financial stability, and this means for every single person living in the communities which we serve. Today, I'm here to tell you that we cannot, as a system, raise enough money to be able to accommodate all of the needs of the citizens that we, I believe, have a moral obligation to serve. As a United Way system, we must be compelled to work with our state government, with our local government, and with federal government, because it's only through the enacting of responsible public policy are we going to be able to sustain the long-term change that is so vitally necessary for us to move the needle on those issues we know are incredibly important to creating a vibrant Louisiana. I'm here to tell you that your United Way is a champion. I'm privileged to serve the advocacy agenda, which is endorsed by what I believe is a courageous board of directors at our United Way. You see, policy and advocacy, it's vitally important, but it can, in the minds of some, be confrontational. We depend heavily on the financial resources that our donors give us so that we can in turn supplement the services that are being provided by state government. We are partnering with the Department of Children and Family Services. We are partnering with the Department of Health. We are partnering in dynamic ways with the Department of Education because, you know, we know that the problems and the complexities that are facing our most vulnerable citizens are not the responsibility solely of state government. It's up to sterling not-for-profits like ours and others who in many ways are experts in the delivery of that services to complement those resources, to make sure that they are wisely invested so that we leverage the state investment of your tax dollars in programs and services that will build a strong Louisiana for its future. I want you to know that our United Way agenda, I think, is at least worth talking a little bit about. Our 2017 policy agenda, entitled United Against Poverty, serves as a key strategy for what we have developed as a blueprint for prosperity. It's important that you know that this includes education You see, from United Way's leadership perspective, young children in Louisiana should have access to high-quality early child care and education that ensures they are off to a smart start in life. So expanding access to high-quality early child care has been a prominent role that we have played in our community. Not only do we fund child care centers and bring them up to quality and only fund those which are of quality, we are fighting here every day in the halls of this Capitol to work on getting additional financial resources, especially to ensure that all at-risk children have access to affordable, high-quality standards so that they can reach their God-given human potential. We understand that women can only be healthy if they are economically secure. Families can only be vibrant if they are economically stable. We fight at Louisiana for the Earned Income Tax Credit, and I am pleased to tell you that there's a sterling reputation that Louisiana has because we led the nation as the only state in the South to implement the state match for the Earned Income Tax Credit. And remember that Earned Income Tax Credit because we'll probably be fighting for something in conjunction with that in the special session. Pay equity has been incredibly important to United Way and to our women's leadership. I really want to acknowledge a colleague of mine who just walked in. Her name is Kim Sport. Kim, would you please rise? Because as I bring up the topic of pay equity, I want you to know that Kim is our volunteer, chairs our public policy committee, serves on our board of directors, but she was appointed by Governor John Bell Edwards as co-chair of the first ever Pay Equity Summit in the great state of Louisiana that was held last year. If you have not seen the reports about that summit, if you have not watched the film, I would suggest that you do so and that you share it throughout your networks, because pay equity is about lifting pay secrecy. You see, you can't know if you're underpaid if you can't talk about it. So promise to share the word. It's already the law. Talk about it and tell your friends they can talk about it. I also want you to know that health is critically important to United Way. And as the previous young lady who spoke right before me talked about sexual assault, I really hope that many of you in this audience have applauded the extraordinary work that's been done by your United Way of Southeast Louisiana in partnership with the Louisiana Coalition Against Domestic Violence and with the New Orleans Family Justice Center. I'm going to show you a book that we assembled in 2014 because both Kim Sport and I had been personally and tragically impacted by domestic violence in our personal lives. I had a friend that was literally murdered by her estranged son-in-law. I want you to know when we began to do research on this topic in Louisiana, we realized that, number one, no one was chronicling that this was a health crisis. We could not go to one place and find all of the statistics in relationship to the number of intimate partner homicides. We had to look that up ourselves. Well, I want you to know this became our Bible, and this became the foundation that brought life and voice to so many beautiful women whose lives were cut short so tragically. But I want you to know that as a result of this research, we gained bipartisan support in this remarkable state, and in 2014, you have a lot to be proud of, ladies, because we made history. We passed the most aggressive package of domestic violence legislation in Louisiana's history, and I want you to know that there's some really good news. At the time that we did that, Louisiana led the nation, second only to Alaska. for the number of intimate partner homicides. If you think policy and advocacy don't matter, I'm here to tell you it most certainly does, because we have moved the needle, and no longer are we the second most lethal, we are the third. And I can tell you that as long as there's oxygen in my lungs, until we are no longer finding this cancer that's eating at us, I'm going to be in the halls alongside each one of you fighting for the vulnerable women and children. I don't have to tell you that the consequences of domestic violence, sexual assault, human trafficking, anything that deals with that, the consequences are grave, because it's not only the human and emotional and social toll, it's the economic toll that it takes on this state. We have a moral obligation to hold hands and to unite, to become informed about those issues that are so important to our women and our families, and make ourselves determined to continue on this journey so that we ensure Louisiana is not only thriving, but the most wonderful place to live, to work, and to raise your children. I ask that you visit your United Ways. I ask that you learn about their information, referral, and crisis management hotline services, 211. If you are not aware that there is a place, because you know, often when you're dealing with individual family health crisis situations, it is a very complicated system, and so often we don't know, where do I go to get the information that tells me what can serve my unique challenge in life? Well, I'm going to tell you, United Way, working in partnership with state government, we've established this hotline 24/7. You can call it from your cell phone, you can call it from a landline. 24 hours a day, highly skilled, well-trained operators are there to take that call and help listen to what your needs are and to get you the help and the services that you need. Make sure you share that with your family members and with your colleagues, because this does not cost you a dime. My message to you today is that each and every one of you take great pride. I wake up every morning and thank God that He had the good fortune to create me a woman. There is no greater time in American history, in my opinion, does it matter so much to be a woman. A smart, capable, determined, passionate woman. We can make the impossible possible. We can make all the dreams that we know this administration is working to make sure we advance to better the lives of women and children in this state. I invite you to stay informed, to do what these women before me have asked you to do. Let them hear your voice. Be determined, be bold, be courageous, and let's change Louisiana. It's in our hands. God bless you.
So ladies, we've got work to do. We've got work to do. And we need all of you helping to get this work done. We can't afford to be last and to continue to be last. And actually right now, we're going further backwards instead of forwards based on where we are today. There is no excuse for Louisiana to be dead last at everything.